Dr. Namrata, Dr. Rajesh for inviting me. And I'll just share my screen. I must congratulate the team at AIOS for keeping the midnight oil burning. You have been working so hard and doing excellent work for academics and for the AIOS members in every possible way. Please keep doing the same. And I would like to start with my small two innovations, which I thought might be useful to some of our members. So I will be talking on the first one, which is actually not very new. It's been around for a couple of years and under development for a few years. I have no financial interest in either of these two instruments. So talking about the first one, I would like to share about why is good capsular Rhexis so important. For example, a broken Rhexis would be a disaster in today's phacoemulsification days. It could risk PCR, a nucleus drop, convert to extracapsular, possibly. A very small Rhexis could lead to problems or difficulty with nucleus management, maybe a broken Rhexis or a capsular phimosis. A big Rhexis could cause IOL decentration, optic captures, tilts. We all know these things, but I thought I must number them, list them. A decentered Rhexis, again, optic captures, tilts, poor visual outcomes for patients, maybe astigmatism. And now with proper biometry, you need effective lens position. So a perfectly placed Rhexis becomes very, very important. And a perfect Rhexis, could be made in one of several ways. And these are the commonly used devices which are currently available. And of course, our surgeons who do not use the Zepto or Femto have nothing lacking. They are beautiful. They can make beautiful Rhexis, a perfect Rhexis, and some of them in as little as a couple of seconds. Some of my friends. So a good Rhexis has to be continuous, which all three devices can do. It has to be well centered, which usually a Femto will achieve very well, but not the other two methods. It has to be the right sized. Again, a Zepto and a Femto would give you the exact size that is desired, but manually you may not be able to tell what is the exact size because there are no ways of judging it. It has to be the right shape. A continuous curvilinear Rhexis is very, very important. Of course, if it is perfectly shaped, it will have a perfect overlap over the optic edge. It should be strong, which I think all three devices can achieve today. And there should be a perfect overlap, which again, manual Rhexis probably misses out. So while manual Rhexis is great and works beautifully well, yet it misses out on a few things, as you can see here on the left side. And we'll try to address those. And of course, the predictability, which in my hands, probably the Femto works best, but today's talk is not about the Femto Rhexis. So this is the reason this slide is often shown. I think this slide is borrowed from Dr. Maipar almost 10 years back when we started doing femto surgery. And on the left is a perfect Rhexis and on the right is a manual Rhexis. Not that this patient will not do well, but potentially there can be issues. There are several ways of doing it. And of course, there is the Zepto, which can be used and gets you a perfect Rhexis. However, there are unpredictabilities there, and of course the added cost. There is again the femto Rhexis, which is as perfect as it gets and pretty predictable as well, and makes life much easier, especially in complex situations. But what I want to show you today is this, of course, is a femto Rhexis. So what can we do? I call it as a perfect Rhexis challenge. There are other devices available. There is a virus, and there are a few other ways you can do it. But this is such a simple device, as you can see, and it's gone through an evolution. There are devices available in the market. I started working on these devices about 5-6 years back, and with one of the companies, and I'll tell you whom I was taking help from. We came to this particular design, which is the final design, which came out about 2-3 years back, and it's it's actually a very simple design, but ergonomically it works best because when you actually put this indentation on the cornea with the Rhexis marker, there are other devices which might have a cross in the middle and centration devices, but frankly you don't need them because you can just center it perfectly on the corneal reflex, the light reflex from the cornea, and you can get a perfectly sized and perfectly shaped Rhexis. Now, this Rhexis can be designed at a 5 mm or a 5.2 mm, depending on what size marker you're using. And it is extrapolated in such a way that, what mark comes on the cornea translates into a 5 or a 5.2 Rhexis. And this indentation on the cornea, lasts only for a couple of minutes. So you can see that it's a very light mark. And it gives you a perfect guide which is the perfect size and perfectly centered on the light reflex on the cornea. So you get a perfectly well centered and a perfectly sized Rhexis, which, as I said, is very, very important today because of the multifocal IOLs, the toric IOLs, which require you to have a perfect overlap. You don't want a bigger or a smaller Rhexis, which cannot be achieved manually, because even if you're a perfect cataract surgeon, you will never be able to get a perfect size going just by what devices you're using. So again, another short clip which shows you how you can do that. And here we will compare it. I think this is the same video playing again. I'm sorry. Now here we are trying to compare it with Virion, because I also use the Virion overlay system in one of my OTs. But as you can see here that even with the Virion, you can get almost the same thing. We are just comparing it here, that whether a manual Rhexis stands up to the challenge of the Virion Rhexis. And you can see here that this Rhexis can be easily completed. And once it's done, you can actually check whether we did a good job. And there you can see that the Virion actually shows that your Rhexis is almost exactly the same as a femto Rhexis or a Virion guided Rhexis, and there you can see the perfect overlap on the lens. So why this? Now there's only probably one area where I thought it would not work, and that's an opaque cataract, because you don't have a red reflex. So we found a way around that as well. And you can see here that when I put a mark on the cornea with the manual Rhexis, it leaves an indentation, but you can hardly see it because there is no contrast. So here what you can do is we typically use trypan blue to stain these cataracts. And one day I just happened to put trypan blue onto the cornea and one drop on the cornea. And as we washed it away, we realized that it leaves a perfect stain on the cornea where you have the indent. So you can probably see it here, that there is a trypan blue staining. And again, this one will not last very long. It's there for just 2-3 minutes, but it allows you to, complete your Rhexis very nicely. And you can see that. So if you have an opaque cataract, you don't have to feel let down. You can still get this Rhexis marker working with trypan blue as you work it on the cornea. It also leaves a small mark on the cornea as it leaves on the lens. Again, here a second case where you can see that we have a small Rhexis mark there, and I put a drop of trypan blue on top. And with that one drop, you can just wash away this, and you have the nice mark over there. Now, in the microscope, it seems quite nicely visible. Here, you may not see it very well, but under the microscope, it's enough for you to get a idea of where the Rhexis mark lies. So I think that gives you the idea. So here, the most important thing is that on the left, you'll see that there is a small cornea where the white to white is small. So if you go by your own assessment of making a Rhexis, you'll probably get it very, very small, because you're using the pupil as a landmark. You can see that the mark here is much bigger than what you might have probably made if you were just making a Rhexis manually. And on the right, if you notice, the cornea is much bigger. There's a white to white which is much larger, and this mark is really, really small. So it's very easy to go wrong. And you can see here that we got a perfect overlap. Had we not used the Rhexis marker, we could have probably gone wrong with an oversized Rhexis. This is how it looks. It's made by Epsilon, and they've been really helpful in getting me over 4 or 5 designs, and finally got to this design. And this is how it looks. I'll be happy to share it with anybody who would like to see it. I'll quickly share my other small device, which is I do a lot of smile surgery. And as you can see here with smile, we do a dissection. I think everybody has seen innumerable videos of smile from all our top surgeons. And once you've dissected the lenticule, the usual way of bringing out the lenticule is using the forceps. You can see here that we go inside the small smile incision and hold this out. You can see that there are possibilities of causing damage to the lip of this incision from the edge of the forceps. So this is how it comes out, and it's very predictable most of the time, but sometimes you can go wrong, as you can see here. And sometimes as you're bringing the lenticule out, if the patient suddenly has a Bell's phenomenon and moves, or if you're trying to tear the small lenticule inside, if there's a small attachment and you're trying to kind of remove it from there, do a Rhexis of the lenticule, as we are doing here, you may end up causing trauma to the lip of the smile incision, and you may have a tear of the smile incision, as you can see here, and that can lead to complications. And you can see here that we have a tear. Now, this often doesn't happen, but when it happens, it can be disastrous and can have poor visual outcomes. So what we are using here is we designed a cannula which is shaped according to the shape of the cornea. It has a convexity, and once you're done through with the dissection, you can quickly go and do the dissection. And then once the dissection is complete, you can use this hydro expression cannula. What it essentially does is it's blunt from the tip. And you can then, once the dissection is complete, you can go in with this cannula. You can see it's a hydro dissection kind of cannula, but it's flattened, and the tip is flattened and it's blunt at the tip. So you go at the 6 o'clock position, and you leave a gush of fluid. So you go right till here, and it's curved to match the shape of the cornea. And once you go and push a gush of fluid over there, you can just watch carefully, and then the lenticule will just burp out. It's like it just suddenly, you see that, you could hardly even see it that the lenticule came out. It's very, very elegant, and it's very safe. And just a small gush of just 0.1 or 2.2 ml will do it. And here's another one. This is another smile. There are 2 variations of the smile dissection cannula. One has a small spatula in the front, which will help us in dissecting if there are any attachments left. And if you want to see here again, this has a small flattened tip to it. So depending on what you would like to use, you can use one of the two designs. I nowadays prefer the first design which I showed you, and the lenticule comes out. And here is a last situation where it really helps if if you have a lenticule which is not fully dissected, which sometimes does happen, and then you want to remove the lenticule, you can go inside and use the hydroexpression cannula. How it helps is that once you push this gush of fluid, the whole lenticule obviously cannot come out, because the lenticule is probably attached somewhere, sometimes at one place or two places. But what it does is it nicely brings some part of the lenticule out, and it showcases you where the attachment is left. So, very nicely you can see now that it's only attached here. You can go inside and remove it there, but much more easier is to just hold the part of the lenticule which is jutting out, which almost always does, and just tug on it and it comes out. So this makes life very easy. And again, you avoid going inside into the cornea. So this is what it looks like. There are two designs, one which has this small spatula on the tip, and there is another one which is blunt on the tip, depending on what you would like. It comes in 23 and 25 gauges. These are also designed by Epsilon. No financial interest, but they've been helpful in helping me design this. And these are two instruments which have made life much easier for me, and I'm sure that they can do that for you as well. I'll stop sharing and